Thank you so much, Ambassador Fletcher, and many thanks to all of you for attending this wonderful, wonderful luncheon. Let me start by thanking the members of KEI and of all the leaders here who have made this extraordinary day possible. I want to start by not only thanking the Ambassador, but also Ambassador Bosworth, who you'll be hearing from in a second, who is a very good friend of our families. Ambassador Han, of course, Mr. Kim, Mr. Kwon, and so many of you who have gathered here today for this very, very important event. And I just want to add a few minutes of reflection on the journey and the sacrifice and the accomplishments of Korean Americans in the first 107 years of our history. And I started this story with deep reflection and respect for my parents. My father, Kwon, who passed away 20 years ago, but is here in spirit today and very proud. And my mother, Chan Jae-sung, who is 80 years young. And I called her this morning to tell her that I was attending, and she was so excited, and she sends her regards too. And both my parents were born in Korea and journeyed to this country a generation ago, searching for the American dream. They were one of the first Koreans in New England, and growing up, I remember so clearly their lessons to me and my 5 siblings. They told us every day of our youth how lucky we were to be born in this country, how honored we were to enjoy rights and freedom in the United States, how blessed we were to speak English as our first language, how proud we should be as Korean Americans, how important it was to get the best education possible. But that was not enough. They stressed every day that ultimately it was critical for us to have a higher purpose in our work, to give back to society and to serve others. And that call to service has inspired me and my siblings, I can say, for our whole lives. And my parents went on to be ferocious and proud ambassadors for U.S.-Korea relationships their whole lives. My father, in fact, went on to Harvard as one of the first Koreans to study law in the United States. Then he and my mother helped found a nonprofit institute related to Korea and U.S.-Korea relations called the Institute. And I have so many memories of our meetings and our efforts to raise awareness about U.S.-Korea relationships and about the importance of serving others. I am the oldest son of this family, and when you're the oldest son of a Korean American family, you may be destined to be the doctor. So, in fact, I went on to medical school and became the doctor, and that was my initial thoughts in terms of how I could best serve this country. But I've been very fortunate in my career then to move on to public health, to serve as a state health commissioner in Massachusetts, as you've heard, and now be appointed by the President and be conferred by the Senate as Assistant Secretary for Health. And as one who has spent his whole career trying to help all people reach their full potential for health, it is just absolutely an honor to be standing before you representing the Department of Health and Human Services and Secretary Sebelius, and also to be part of the Obama administration. Many of you know that there are other members of my family who have received a lot of attention as well, particularly my brother Harold Coe. Harold is a lawyer, very well known internationally. He's the former dean of Yale Law School, and now he is the Senate-confirmed legal advisor to the State Department under Secretary Clinton. He sends his regards. He wished he could be here today, but he sent me as the ambassador. So we'd like to point out that my mother now has 6 children, 11 grandchildren, 1 great-grandchild, and 2 Senate confirmations. And I must say that in October, when the President announced the new White House initiative on Asian American and Pacific Islander affairs for the country, he asked about 10 of his Senate-confirmed members to stand behind him in the east wing of the White House and stand next to my brother Harold for the signing of that executive order was one of the proudest moments of my life. And my mother liked the photos too. So, together with my brother Harold and with the inspiration and support of my family, I'm now in the new post, eager to work with all of you to improve U.S.-Korea understanding and interaction, particularly in the area of public health. And of course, we have such a critical time now with discussions and tremendous progress on health reform. We're working together to combat H1N1 and a whole host of other issues that threaten the well-being of Americans and Koreans and indeed people around the world. I was absolutely honored in July of 2009, about a month after I started, when the Minister for Health, Welfare, and Family Affairs, Minister Kwon of South Korea, came to Health and Human Services, and she and Secretary Sebelius signed a memorandum of understanding on health and medical science between the United States and the Republic of Korea. And to attend that ceremony as the new Assistant Secretary for Health from a Korean-American family was a very, very special moment for me and one I treasure. Already, our department has worked closely with Korea in a number of areas. For example, as the Assistant Secretary, I oversee a national health planning process called Healthy People, which has had a 30-year history. And I understand that several years ago, representatives from Korea came to the United States to study that health planning process and has adopted something similar in that country. Well, adopting a vision and mission statement of a society where all people can be healthy and happy. I also understand that Korea has had the greatest gain in life expectancy between 1960 and 2007 of all the countries in the Organization for Economic Cooperation and Development, the OECD. And then, as one who started my career and now enjoy my current post as a professional absolutely committed to health promotion and disease prevention, it was a great honor to be in Seoul about a year and a half ago and help launch a new Korean society on research in tobacco, see that the trends in male smoking are starting to decline quite rapidly there, which is a tremendous sign of progress in public health there. Also to see that South Korea has achieved universal health insurance in a 12-year span from 1977 to 1989. And there's so many other ways that we could work together to improve public health of the United States and South Korea and indeed people around the world. I want to close with a reflection because my late father, Kwon, was the ambassador to the United States from South Korea in 1960. I was a young boy then, and we lived in the city for a brief period of time while my father served as ambassador. And I remember so clearly how excited he was to be in service to his country of Korea, how thrilled he was to talk about dreams for better relationships between the U.S. and Korea. And one senator he respected so much and enjoyed meeting so often was Senator Hubert Humphrey. And I distinctly remember my dad telling me stories about Senator Humphrey. So now, as the Assistant Secretary for Health, to come to work every day in the Hubert Humphrey building of the Department of Health and Human Services in Washington, D.C., just steps away from the U.S. Capitol, is a great honor for me. And I start each day by walking into the Humphrey building, looking up at the grand photo of Senator Humphrey, and reading these words next to his portrait, quote, "The moral test of government is how that government treats those who are in the dawn of life, the children, those who are in the twilight of life, the elderly, and those who are in the shadows of life, the sick, the needy, and the handicapped." I think of the senator, I think of my father, and I go to work. So thank you very much for having me.
Thank you, Dr. Coe. What an inspirational story. I'd like to ask David Kim, please, come next.